Thank you. Thank you very much, Ted, and all the participants. I missed the first session. I was just listening, but had to move out. But I am very interested in this conversation because I've worked all my life in the public sector, and I had a number of inputs that I thought were spot on and would be extremely helpful if the investors, the people around the table could reflect on. And I use an example of, a country where I worked and grown up and actually worked at the highest policy level in the office of the president, South Africa. I'm South African. And I think there are a few things that investors need to think about. We need to consider the context in which entrepreneurship and partnerships with government can or cannot work or need a bit more work around them. Think about, firstly, I would study the relationship between the government and the private sector in country. Is there trust? Is there a way of working together where people understand that it's not only about profit, but there is a relationship there that is committed to achieving the outcomes for the nation, not just for a particular group. And I found where there are tensions because of the understanding, because of ideology, because of a lot of other things. You don't get to that space where people understand that we actually are partners. They don't view donors and or investors as people who've just come to test something or do experiments, as people call them, and leave people. So a good understanding of that would already tell you if the package or the invention or the new innovation you're bringing in is going to work. And I found that where government is a bit more open, a bit more embracing, willing to take risks as well, things have worked better. And remember, in many low-income countries, the historic context is that there's been a lot of aid coming in and a lot of prescriptions that have come with that aid. So there is a traditional attitude, that people then get, that, you will get this grant, people will do X, Y, Z, and then go off and report somewhere and not speak to the community. So there's that historic relationship as well that people need to deal with. And then you need to also consider the capacities and the enabling environment for young entrepreneurs in those countries, because I think they also need support. So when you think about all those things and consider that what you are driving, your endpoint is health outcomes, we need to really also be honest about the fact that, there are so many other issues that will impact on those health outcomes that will not be responsive to the innovation. And therefore, we must be humble about what something that we bring on board will achieve. So I think, with those things in mind, there are successes that people have seen. And I feel also that if we take women and people along with us as we do this, successes are better. So what I've seen, maybe as an example of what I think is a good innovation and a partnership with the young entrepreneurs is, 2-3 group of women, bright people who've thought about how to bring services to women during the COVID pandemic. Got a lot of traction because there was a lot of engagement with the communities, and because these people live in that community, they understood what the barriers were. So when you put your package together and you bring it to an investor, and the investor puts you under pressure with questions as to why you think this will succeed, this group of women were able to articulate what it is that they think will be barriers, where will they step back and let others do something, So there are many opportunities, but I think if you skip the step of building the trust that I had one of the speakers referring to, then you likely to not be very successful in the things that we're trying to do. And with some of the points that were made by my colleague from Zambia on investment in surgical interventions, it's very difficult. It's difficult because there is obviously, the costs are huge. But I think in the way we package the conversation to governments, we must help policymakers to understand what we're talking about. Where a government is also not working in, cohesively, each minister gets, a budget to go off and, build roads, and this other one gets money to go off and build clinics, and the two are not talking together. You find that you have a clinic where there's no road, because the special planning approach is based on, I'm going to do this and I'll do my colleague, or, and so the politics also come into this space. So I think there's a lot of hard work to be done on the side of, interdepartmental, intersectoral planning by states, space to be provided for private sector as a real partner, with no concerns about trust and things like that. And then on the demand side, a good understanding by the beneficiaries of what it is that is being done and how can they also have ownership of their own well-being, and not all, rely on somebody else must always come and do something for me, So there's a lot, I think, that can be done. And I really, really hope that this group, TED, can walk the path with us. On cervical cancer, I believe there are enormous opportunities, self-sampling at home, the artificial intelligence based in innovations and technologies, telemedicine, how we can support healthcare providers and all of those things can make a huge difference, and like I say, for me, the common ingredient that always brings success is taking people along, because the environment, their understanding, the culture also must not be forgotten, so that people really fully understand that this is going to be a benefit. And I have a stake in this, and the stake is that I come to the party fully committed to be supported. So I think this is really, really, for me, very, very, very exciting. We've always understood that in the surgical space, it's a tall order. Like it's a hard mountain to climb. But we've got also to make governments understand that many more patients, for lack of a better word, benefit. If you support a surgical intervention for women, you say I'm going to support for cervical cancer. You're already dealing with maternal issues. You're already dealing with sexual and reproductive health issues. You're already building capacity for other surgical interventions, and that is how I think we should package it. We mustn't package it as just for the women's cancers, just for this, because then people they just see a big cost. And, there's also a worry that, the investor might not return after a year or two if things don't go right, So I think a trust must be built from the beginning, taking people along, very important, understanding the ideological stance of the government towards the private sector, very important, and then, taking the time to invest also in young entrepreneurs in those countries and in those environments who can then become your allies, learning from whoever is bringing an innovation, but also benefiting by infusing that with local knowledge so that people can then understand what is being done. So let me stop here and say it's really been an interesting, very dynamic conversation. I've been listening for a while now, and thanks, Ted, for extending the invitation to WHO.